Hi everyone, this is Mohit Kumar and I'm going to demonstrate today one OSCE video for the ophthalmology. So let's begin with the eye examination. Hello sir, my name is Dr. Mohit. Can I know your name and age please?
My name is Govind Gurjar and my age is 23.
So today I'm going to do your eye examination. So is it fine with you?
Yes.
Okay, so after taking proper consent, after taking proper health history, family history, and past medical history, now we are good to go for the complete eye examination. We're gonna start our exam with the gross eye examination. So first of all, we will observe the eyes and we will see the symmetry of the eyes. Then we will just look inside the conjunctiva as well. Is there any kind of the extra redness or color changes in the conjunctiva? We have to also observe the external structure around like eyelid and the orbit as well. There shouldn't be any kind of the color change or any kind of the visible deformity or the lump or mass. So for our patient, we don't see any of these things. So we're gonna palpate the eye orbit as well. So sir, let me know if you feel any pain,
No.
so that we can see if there any kind of the mass around the eye orbit or any deformity, or patient feel any tenderness while palpating. So for our patient, that all things are fine. So now we will start with the vision test. So for that, we're gonna start with the visual acuity examination. So for the visual acuity, we have Snellen's chart with us. So the distance between patient and the Snellen's chart should be 20 feet. So sir, can you see the Snellen's chart over there?
Yes.
So what you have to do, you have to read the letters from the big one to the smallest one as much as you can, and you have to cover your one eye with the palm. First, you have to make curve in your palm and just cover one eye and then read the letter. Sir, please start reading. Let's try with the right eye.
E F P T O Z L P E D P E C F D E D F C Z P E F E L O P Z D D E F P O T E C.
Very nice, sir.
E F P T O Z L P E D P E C F D E D F C Z D F E L O P Z D D E F P O T E C.
Perfect. 20 by 20. The vision of your left eye is 20 by 20. So now we're going to do the pupillary examination. We will see the pupillary reflex to light. So we're going to just put the light inside our patient's eye and we will see the direct pupillary constriction. Okay, now this one for the direct, yeah, pupils are going to be contract. Okay, now we will check for the consensual. So you look at my side. Okay, so the both pupil are contracting. For our patient, this pupillary examination is normal because our patient pupil was contracting on the direct and the consensual test as well. Sir, you have to focus on the tip of this pen. Okay, let's begin. We have to check all 6 extraocular muscle movements. We have to see is there any lag in the extraocular muscles. Make complete H. Okay, sir, now I'm doing the accommodation test for your eyes. Okay, so what you have to do, you have to look at this tip. You have to look here and just follow this. Okay, that's perfect. So now we are going to do the next examination, which is the visual field examination. So for that, we're gonna just check the peripheral vision of our patient. So generally, we know for the normal person, the lateral vision of a eye should be more than 65 degree, and the nasal vision should be around more than 45 degree. So let's check for our patient first for one eye. So will you please close one eye like this? Look at me, okay, straight, don't move your eyes. Okay, so let's start. You let me know when you see my moving fingers. Okay,
Yes.
okay, look at me. Okay,
Yes.
okay, we will do it together. Okay, do now, no need to cover, just look at me and let me know when you see my fingers moving. Okay,
Yes.
okay, so means our patient's peripheral vision is good. So before starting fundoscopy, we have to also make sure we're gonna just turn off lights and make the room darker. So sir, what you have to do, you have to see the lateral side. Okay, because I'm going to do first the left eye. So sir, you have to see laterally. Okay, okay, now we're gonna check for this one. You have to see this side. Okay, So we have just checked our patient both eye with the help of the fundoscope, and our findings are we were able to see the red orange reflex, and we have checked the margin of optic disc was clear, and the retina was intact. There was no sign of the inflammation in the retina, no extra vessels formed in the retina, so everything was normal. So now we are going to do the tonometry for our patient. As we know, the increase in the intraocular pressure could be a sign for the glaucoma. So we have to check the intraocular pressure of our patient. So we don't have the machine for that. We have to just palpate our patient's eyeball. Before touching our patient's eyeball, we have to make sure we have cleaned our hand from the soap and water properly, so that patient would not feel any irritation at that when we are going to touch the eyes. Okay. Let's begin first with right eye. Will you please see this one, this side? Okay. For this one, look at this side. Okay. So as we have seen, while I was just palpating the eyeball, that was really soft. So it means intraocular pressure of the eye is normal. So now this is the time for the documentation. So I have examined a patient of 23 years old whose name is Govind Gujar. In the gross eye examination, I didn't find any kind of the asymmetry or the deformity. And for the visual acuity test, we find out like for the OD and OS, both were 20/20. And for the extraocular muscle movements, he was able to follow the complete edge. So means all the 6 muscles are doing well. And for the finger wiggle test, the patient was able to see a broad area of the visual field. So it means the finger wiggle test was also normal. And last we did with the tonometry, so the intraocular pressure of our patient's eye was good. So thank you so much, sir. We have done with our eye examination. Thank you so much.
Thank you.